Tonight, first up at 6 o'clock, a huge breakthrough today in the fight against COVID. The FDA has approved Pfizer's pill to treat the virus.
And doctors say this could keep a whole lot of people out of the hospital. Channel 3 Eyewitness News reporter Mike Savino is joining us live with what he uncovered. Mike, what are you learning?
Well, now the next step is that public officials need to work out some of the details about this rollout, including who gets priority and where they might be able to get a prescription. But one thing we do know is that this pill has to be taken within the first few days after infection, which makes it important that people be able to find a test.
As the things are changing with the pandemic, our toolbox is getting larger and bigger.
Doctors say a new Pfizer pill will change the way we treat COVID patients. The pill was approved today by the Food and Drug Administration, and it's meant to reduce the risk of hospitalization.
Pfizer is telling us that their Paxlovid is 89% effective at reducing the risk for hospitalizations.
The FDA approval was only for people 12 and older who face higher risk of serious case, and supply will be limited at first. So how can people get prescriptions?
I'm sure that we will be hearing very soon from either the Connecticut Hospital Association or the Department of Public Health on what to expect.
One thing we do know, the pill needs to be taken within the first few days after infection to work. So how are healthcare providers improving access to tests?
The logistics about getting the testing to the labs is a challenge. So our teams are working, they'll be working in the Christmas and New Year time to make sure we create more access.
We already had other approved treatments, including remdesivir and monoclonal antibodies, but those require patients to go to a hospital or clinic. Doctors say treatments you can take at home can make COVID something easier to live with.
At some point, this pandemic is going to become an outpatient disease rather than an inpatient disease.
Now, doctors stress that we're nowhere near that point yet, and they also say that this pill is not a sign that we can ignore public health guidelines like social distancing, wearing masks in risky situations, and getting the vaccine and the booster. Live from the newsroom, Mike Savino, Channel 3 Eyewitness News.
All right, Mike, thank you very much.